Hey everyone, welcome back to the 1-800-VICTIM-2 studio. So today I'm going to answer one of the most common questions that we receive from our clients regarding their cases. And of course, the clients want to know, how long is my case going to take? It's certainly a legitimate question. And unfortunately, and I always feel bad because, you want to be able to give the client a straight answer, and you don't want to come across as a lawyer who doesn't, has a reputation for not giving straight answers. But the truth is that it's a difficult question to answer. But let me try to give you some basic guidelines. Well, first, just generally speaking, we always tell our clients that while it's hard to guesstimate how long a case is going to take, we do say they usually take a year, sometimes a little longer and sometimes a little less. And it could also take multiple years, depending on the extent of litigation that's required. But let me explain some of the factors that determine how long a case takes. For one, if a client may be treating for 5, 6, 7, 8, 9 months, we certainly can't settle the case until the clients have at least wrapped up most of their treatment, so we know the extent of their injuries. And it's at that point that the doctor can write us a report that will summarize the treatment from the very beginning, the diagnosis, and then at the end to the prognosis, which is what the client can expect in the future. And it's over the course of the treatment that prognosis is generated. And we certainly don't want to settle a case while the client may have to undergo additional procedures, whether it be an operation, surgery for a shoulder or knee, or injections. So we don't want to settle the case until the client has, for the most part, wrapped up their treatment. Now, the other issue is really just a practical issue. It depends on who the insurance carrier is. Some carriers are more apt to settle than others. So quite often it just really, for that practical component. We can't force a carrier to make a settlement offer, and if a carrier is not one of these carriers that actually has adjusters that reviews cases and has supervisors that give them authority to offer the money. Some carriers are just not. They just don't do it. Some carriers are more focused on putting out fires when a case is on the trial calendar and heading for trial, and they're focused on those cases as opposed to trying to move the cases a year after the accident. So that's just a reality of the case. And of course, it also depends on how much money we're asking for. If a client has surgery or multiple surgeries and we're dealing with a big policy, those cases are going to take longer because we're asking for a larger amount of money. The bottom line is, though, we know that our clients are looking to get their cases resolved. For the most part, we all want to get the case resolved quickly. Everybody, from the insurance company to the clients, it's in everybody's interest to try to resolve the cases quickly. Now, we will push the cases aggressively with the litigation, but always with an eye towards settlement. If we can settle the case and get the clients a reasonable settlement offer that they're happy with, and at the end of the day, it's the clients who make that decision. But if we can get the clients a reasonable settlement offer that they're happy with, well, that's terrific. If we can't get them a reasonable settlement offer, then we just press ahead with the litigation. But either way, the attorneys of 1-800-VICTIM-2 are going to process the cases aggressively, while keeping in mind that many clients do want their cases settled sooner rather than later. So don't be a victim twice. Call the attorneys at 1-800-VICTIM-2.